Welcome to the Line Opinion Panel, our group of 4 people who have all agreed to study the news each week and sit down with us to offer their insight. We start this week with Laura Beale's article for the New York Times in which she detailed Carlsbad Medical Center's practice of suing its patients a lot. Since 2015, the Times found the hospital has filed more than 3,000 lawsuits and 500 already this year. Joining us this week, we have 2 new Line regulars, both familiar faces, but now committed to more frequent appearances. Former State Senator and Line regular Dee Dee Feldman. And another regular and former State Senator Diane Snyder's back with us. They're joined by Ed Perea. He's a lawyer and public safety expert. And we're pleased to have Julianne Grimm, editor of the Santa Fe Reporter. Now, Dee Dee, you were the one who put this on our radar. This story was shocking. I mean, you're talking folks that have, I would say, medical bills that are not hundreds of thousands of dollars at first, but they become that as they get sued endlessly over and over. What's the deal here? Why are we suing so many people in New Mexico who clearly don't have the means to pay? What's the angle here for this hospital and others like it?
Well, the hospitals are trying to survive. They're using, and of course the deductibles and co-pays have gone up.
That's right.
There's still a lot of uninsured people out there in rural New Mexico, and the hospitals are the only games in town.
That's right.
In places like Carlsbad and Portales and Roswell to some degree. And so, they're shifting. They're shifting. Cost shifting is the name of the game for hospitals because they get paid one rate by Medicare, one rate by Medicaid, and then who knows what the private companies are paying them because their contracts are not transparent. The one thing they can do is gouge their patients, particularly those that are least able to pay, those without insurance. And that's what's been happening. Even though this is illegal according to the Affordable Care Act.
That's right.
There's no enforcement there, and so the hospital is doing what it can get away with, it seems to me. And then when they're called upon it, then they back down a little bit. They back down a little bit and say, okay, well, for people who make less than $19,000 a year, we won't come after them with bill collectors and garnishments and so on. Well, isn't that nice of them? If it hadn't been for the press, and if it hadn't been for advocates demanding more transparency, they'd be doing it again and again, and they probably will try to do it again and again. No
doubt. Ed, I want to read you a quote here. Dee Dee touched on this just a little bit. It's endemic of the bigger problem that we have here. Here's the quote from Melissa Suggs. She's a spokeswoman for Carlsbad Medical Center. The majority of accounts from which we seek to collect payment are patients with insurance who have not fulfilled their deductible, co-payment, or co-insurance responsibilities set by their health insurance plan. This deductible thing is killing people. Do you know what I mean? It is absolutely killing people. You got a $5,000 to $6,000 deductible out of pocket. That's just not going to work for a lot of New Mexicans. You see the problem here? So we got the hospitals on one side and the patients on the other, and this big mess in the middle. It's just not working the way it is.
Well, and insurance companies are trying to manage their own liabilities, and they're there to make a profit. So what they're looking at, they're trying to make healthcare affordable while coming through the door. But then, and most people aren't thinking about that emergency. They're not thinking about that situation where they need healthcare. They're looking at the bottom line. What is going to be my monthly payment? And the lower they make that monthly premium, the more attractive the policy can be. It's not until there's an emergency or emergency surgery or something of this sort that they realize that, oops, they signed up for a $10,000 deductible or $20,000 deductible, and then what insurance companies are doing as well. And when you're signing up for that insurance, you're not thinking about this, but they're putting caps on coverage. So you think, I have insurance, I am covered, and suddenly before you know it, you've exceeded that cap and you have a huge deductible. And most average people don't plan for that, and it really does put the patient in a tough situation. And sometimes, it adds sort of insult to that literal injury. You go to the hospital with an injury, and suddenly you get the bill, and now you're insulted.
Insult to injury.
The interest is the salt in the wound.
There you go, and so it becomes a shock. I mean, I think it's a system problem. It's a national problem, and now it's bleeding over, so to speak, into New Mexico.
That's right.
And we're seeing more and more lawsuits, of course, we always want to know, well, what's behind this change of business model? There was a time that hospitals would work with the patients to try to find that, whether it's mediation or some other levels. Now it sounds to me like in some cases they're shooting straight to litigation. So.
Well, Julianne, it was mentioned by Dee Dee that the folks have made a change there at the hospital. They are not going to charge, I'm looking at something here, they are no longer going to sue patients whose incomes are below 150% of the federal poverty level, or roughly, as Dee Dee mentioned, 19 grand a year for a single person. Why isn't that the way we do it here across the board?
Well, I find that there's a common thread in this story that we're talking about from the New York Times. You know, National Public Radio did a story about this, a totally different hospital. Their story was about a hospital in Virginia. In both cases, the hospitals refused to really explain themselves, and then they came out with this, oh, we're going to change our ways. And I was wondering, and I'm glad that Dee Dee brought this up, are they doing this? Are they making this decision because they're embarrassed? Are they doing this because they just didn't realize what the effect of their practices were? I mean, it seems disingenuous. And, you know, the fact that there's a lack of national record keeping and national data about this puts a state like New Mexico and a rural community like Carlsbad in a particularly vulnerable situation. I'm curious about all the rest of the New Mexico hospitals. You know, I wonder if there's a way for the legislature to study this. I'm sure there are journalists all over New Mexico who are now looking, you know, at more of this in detail, because we don't have the resources of the New York Times to do that kind of research. But I know people in Santa Fe want to know what's happening with Presbyterian and Christus. I know there are communities like Taos, communities like Espanola that really have one medical facility, and so no, it's not the way it should be. I think was your original question.
That's right. No, you nailed it. Believe me. You know, Diane, interesting. Julianne mentioned local stuff. The Department of Health here actually has a website that lists the Medicaid price for 9 common procedures. But more interestingly, there's funding to start tracking what people with individual or employer-sponsored insurance pay. To start tracking that. Julianne just sort of brushed by that just now. Is that a good start for you? Should we be something a little more robust here, given the problems that this article has unearthed?
I think any step forward is a good thing.
Okay.
What I'm concerned about is that you have to have all the pieces. You can't just have this one we're talking about. We have to know what insurance companies are having as deductibles. What is each hospital? The problem goes back to is rural New Mexico is you've only got one hospital in town, and if you've need to go to an emergency room, you don't have a choice, and then you end up with a bill of $1,500, and your deductible's $3,000. So you're between a rock and a hard place. You can't pay either one of them, and so it leaves our people in a very serious position.
Let me read something to you, and I want to get your reaction, then others, about possibly a legislative fix here. From the article, again, about the Carlsbad Medical Center. In May, a nationwide survey by the RAND Corporation found that private insurers paid Carlsbad Medical Center 5 times more than Medicare would have paid for the same services.
Right.
Wow.
5 times. See, this is where I think the legislature could step in. You see what I'm getting at here?
It sounds to me like the hospital's overcharging to start with.
Yes.
Right.
Big time.
Because they're trying to make up for the losses that they have in Medicaid and Medicare. So
and so when an insurance company negotiates a contract with a hospital, then they're having to understand that that's what they're doing.
That's right.
They're having to pick up the cost.
Impossible as a consumer of medical services, whether you're having a kidney stone procedure or you're having something very serious and on a very emergency level, you can't find out how much is this going to cost me.
Right. Yes, you can.
You know, but when you ask them, I've personally tried to do this, then the bills come, it's a different amount than what they told you. It takes 6, 8, 10 months, a year. By that time you're in collections. It's such a nightmare for the consumer.
That's always going to happen, but there are states that have addressed this. In Pennsylvania, in Maryland, they have a robust system of hospital report cards. And the hospital report cards are based on something called an all-payer claims database, which is what we're moving toward finally. I've twice tried to sponsor this in the legislature. We've been moving. It's taken us 10 years to get this far. But You have to have, for the consumer, a report card that shows not just that a knee replacement in one hospital costs $30,000 and $3,000 in another hospital, but you also need the quality measures. How successful are they in various hospitals? What's the hospital readmission rate for some of these procedures? So that consumers can, and ideally in New Mexico it should be posted on the Sunshine portal. It should be a government function where the information is given to the health department. It's just been really murder to get that information.
And Dee Dee, the complaints that I hear are once you get the
Real quick,
bill,
Ed, if you could.
the burden falls on the customer to undo or to correct, and then that's an uphill battle. And so that's something else within the
This
system.
is why people are going to Mexico for medical services. This is why. It's
Yes.
crazy. We'll have to leave that there. But speaking of hospitals, emergency rooms have seen a spike in lung illnesses that medical experts think are related to vaping. We dig in next.